today we are very happy with what we've seen in the vaccination. We are starting to make appointments for our 85 years old and over. At noon, we had more than 70,000 appointments that were made on our different platforms. We're also happy with the very good news that we had this morning. We will receive 700,000 doses for the combination in March of Pfizer and Moderna. And I confirm that we will start giving the second dose no later than March 15 as planned. I also want to come back on a few points. All regions outside of Greater Montreal will begin vaccination for those age of 85 and over in the week of March the 8th. You have to understand, however, that we have also some deliveries in the sub-region. So if I take the Bas-Saint-Laurent as an example, we will have vaccination in one city in the week of March 8th and in another city in the following week. Also, we know that making appointments for accompanying person have raised some questions this morning. We are working to improve the situation. It will be corrected tonight when the platform is down and will be corrected for tomorrow morning. But also, I want to be clear on this point. For the person that accompany the person that are 85, and if you're 70, you could not this morning take this appointment at the same time. So please take the appointment, and when you will come in our center of vaccination, we will make sure that you get the vaccination at the same time. This will be corrected as well over the weekend. And again, I just want to ask Quebecers, they've been very patient and comprehensive. We monitor those small adjustments that we need to do. Sometimes we have those quick problems, but we want to solve them very quickly, as we did this morning. So don't hesitate also to communicate with us, either by phone or by email, and we'll make appropriate and very agile confirmation. The other good news is, as I mentioned, this week we have some agreement with large companies to start preparing for the vaccination in the bulk of the summer. And we have an agreement as of this morning with the Treasury with pharmacists. So now we have the businesses and the pharmacists that will complement what we do in the network. That's another good news. So I think that on the variant side, we had an increase as of yesterday of an additional 170 cases that need to be confirmed. So that's we have a total right now of what we call presumptive cases. They need to be confirmed by sequencing. So this is something that will be taken by Dr. Arruda next week into consideration when we move on different region, colors, and other measures. But for now, we will keep monitoring those numbers and being very transparent with them. The good news is the total is not changing. We're still at roughly 800 cases per day, including those variants. So far, so good, but we need to monitor that over the next few days.